Is predatory behavior something to medicate? Like everything else, it depends. For context, I was tagged in the comment section of one of Dr. Serena's videos where she was replying to a commenter who had asked her about adjunctive medications for their dog who was showing an increased predatory response. The commenter described that their dog had become more reactive towards squirrels lately. So predatory behavior itself is totally normal. In fact, when we look at intentional breeding of dogs, we have intentionally amplified or muted or left alone various pieces of the predatory sequence. We have indeed used it to our human advantage for forever. A modern evidence-based take on predatory behavior is that it is something we should be collaborating with, including finding appropriate and safe outlets for, not something we should be trying to suppress. But like everything else, context is incredibly important. I work with dogs who are chronically dysregulated. These dogs may have anxiety disorders, trauma disorders, chronic hyperarousal, and there's a wide variety of ways that this chronic dysregulation can appear. And some of those ways might include behaviors that themselves are normal or typical, but we are seeing them at a really intense level, whether that is the intensity of the behavior itself, or the duration of the behavior, or the broad generalization of the behavior. There are a lot of ways that this could show up. So for example, I could have a herding dog who may be genetically predisposed to engage in herding behaviors. For this dysregulated dog, we might be seeing that at an intensity that has less to do with normal, natural expressions of species-typical behaviors and more about that dysregulation. So this herding dog, for example, might be behaving aggressively and going after the feet or ankles of anyone who tries to move within the house. And this dog is distressed. They are not having fun. We're seeing that their anxiety, their sensitivity to sudden environmental contrast and movement is being displayed through aggression that is sort of flavored by what they've been reinforced for generations genetically for doing. There are lots of variations of this, even outside of, what we think of with the predatory sequence. We might see, for example, a dog become super hyper focused on food in contexts where they are stressed out. We might see them be very, very invested in fetch. There are so many ways that distress can present itself that seems inobvious to us. This idea of reactivity toward squirrels or other prey animals can be one way that we see that appear. I have had many clients whose humans would describe them as having intense prey drives. They go very high on the stress scale. The behavior is incredibly intense. They are totally out of their thinking brain. They are not easily redirectable. They are not easily bouncing back from the stress event. But this isn't a collaborate about predatory behavior moment. This is a displacement of sorts of the distress they're experiencing. And part of the way we can see this is that we address the overall anxiety that's happening, and we see the predatory behavior come back down to much more levels that we would expect without actually even beginning to work on collaboration around predatory behavior. So if I have a dog with an anxiety disorder, as the original commenter did, I am suddenly seeing a huge uptick in predatory behavior that is difficult to redirect, causing distress. The dog is not recovering from it quickly. It's contributing to our trigger stacking. And this dog is distressed, right? So that's the thing underneath that, is that this dog isn't actually having fun. Although that can be really, really hard to interpret sometimes if we're not looking at all of the nuances. Then I would be curious about what has changed. Is the dog getting less sleep? Has there been a change in appetite? Is the dog experiencing pain? Are we seeing an allergy flare? Have there been routine changes, predictability changes? Has there been an increase in stress? Are we seeing any other shifts in behavior? And then depending on what the answer is, what we're able to figure out, that certainly could warrant a conversation with the dog's veterinarian, their veterinary behaviorist, to discuss whether an adjunctive medication may be supportive for the dog during this time. But it's not so much that we are medicating predatory behavior there. In this case, we would be medicating an increase in anxiety or hyperarousal, or investigating pain or allergies or that sort of thing. So the predatory behavior here is a symptom, just like all other behavior. And what we're identifying here is that this is not, in this theoretical situation, typical, fun, enriching, predatory behavior, but rather a displacement of distress.